In this video I'm going to present the adduction test for gluteal tendinopathy. Get our very own assessment ebook and mobile app. Links are in the video description. Hi and welcome back to Physiotutors. Gluteal tendinopathy, which falls under the nowadays used umbrella term Greater Trochanteric Pain Syndrome or GTPS, is part of the differential diagnosis in patients with lateral hip pain. Grimaldi et al. From 2016 conducted a diagnostic accuracy study on different diagnostic tests that were contrasted to MRI findings indicative of gluteal tendinopathy. The adduction test had a sensitivity of 20% and a specificity of 68.7. When resisted isometric abduction was added, the sensitivity rose to 38% and the specificity to 93.3. The test has a limited capacity to exclude the condition, and it's the first study to investigate this test, which is why we give it a moderate clinical value. Alright, so to conduct the test, the patient lies on the bench in diagonal side-lying position on their unaffected side, with the hip and knee flexed to 80-90 degrees. So support the affected leg with the knee extended in neutral position so that the leg is in line with the trunk. The anterior superior iliac spines are perpendicular with the treatment table. Whilst stabilizing the pelvis, the leg is moved into end-of-range hip adduction with overpressure. Subsequently, the patient is asked to perform isometric hip abduction against resistance. This position adds both passive and active tensile and compressive loads on the tendons of the gluteus medius and gluteus minimus. A positive test is the reproduction of the patient's lateral hip pain in the region of the greater trochanter of at least 2 out of 10 on the NPRS. Alright, this was our video on the adduction test. We recommend you continue by watching our video on the greater trochanter palpation, as this was the test with the highest sensitivity in the trial, by clicking on the left. If you like this video, remember to give it a thumbs up and leave a comment down below with any thoughts that you have. Please subscribe to our channel if you haven't. It's completely free and it helps us out a lot. Check the links down below in the video description because I promise you, you won't regret it. And as usual, this was Andreas for Physiotutors. I'll see you in another video. Bye.